Hi, I'm Becky Hartzell, and I'm here to talk about diversified medical occupations. That's a mouthful, so we'll just call it DMO. So we meet August through May on Mondays through Thursdays, 10 a.m. to 4:30 p.m. We don't have classes on Fridays, and that helps to allow students who want to work Fridays, Saturdays, and Sundays to, pay for their bills. So we prepare individuals to work in allied health fields, whether it's a medical assistant, phlebotomy technician, or pharmacy tech. And I'll go through those in a little more detail in just a sec. So, first of all, the first third of our course, everyone learns the same things. We learn anatomy and physiology, medical terminology, medical math, and about the allied health fields. We'll explore what a medical assistant does, what a pharmacy tech does, what a phlebotomist does, where do they work, how much do they expect to earn, what kind of skills do they need. So a medical assistant, in a nutshell, is the person who takes you back in the doctor's office. She takes you from the waiting room back to the doctor's office, takes your vital signs, could also be a male, enters your medical history in the computer. She might, or he might, assist with minor surgeries, might make referrals, call your test results, call your your prescription refills to the pharmacy. A medical assistant learns front office and back office information. So they also learn some clerical or administrative tasks. A phlebotomy technician works in a lab typically. They draw blood from your veins or poke your finger for that type of testing. They might do urine screens. They might do rapid strep tests. But typically they work in a lab and collect specimens. A pharmacy technician would work in a drugstore. That would be the person who greets you at the window, who makes sure your insurance information is up to date. That pharmacy tech might bring your prescriptions back to the counter, say, do you have any questions for the pharmacist? Check you out. A pharmacy tech has to work underneath a licensed pharmacy. Okay, so once students choose a pathway, then the middle of our course focuses on the skills and knowledge that you need to relate to your chosen pathway. So we split into groups, and medical assistants will learn medical assisting things, phlebotomists will learn phlebotomy things, and pharmacy tech students will learn pharmacy tech things. All right, so the final third of our course, this is toward the end of February, our students start their externship. And that externship is at a site out in the field. They're doing the job that they would do in real life, okay? During that externship time, before graduation, they also take their credentialing exam. The credentialing exam is nationally recognized, and 100% of DMO students have passed this credentialing exam. So our class size is limited. Pre-admission testing is required because the course is difficult and it's fast-paced. We do have financial aid available for those who qualify. It's usually through Pell, but sometimes we have other grant information that we can pass along. So for more course information, you can call 567-201-2873 or email at bhartzell, HARTZELL, at vsctc.org.
Would you like to show us your room?
Okay, so we have computers set up so that everybody can learn how to do electronic health records, entering patient information into the computer, scheduling appointments, that sort of thing. We have a library where with medical dictionaries and CPT coding books and ICD-10 coding books and drug books. We We have games, so we have prizes. And then, kind of like our classroom is set up for a meeting right now, but we sit at these tables. Our stock is stored in the locked cabinets back there, back where those tables are. It's typically where we have our games and things like that to help review the information that we've gone over. And then our lab setup is over here, and this is where we learn our hands-on and practice our skills and do our skills assessments, our competency exams. Okay,
Thank you, Becky.
thank you.